Hey, welcome to the conversation that's as diverse as the dogs that we adore. This is Gun Dogs and Guard Dogs, ultimate podcast dedicated to talking sense about dogs with Les Graham and Ross McCarthy. They work with all breeds of dog, but one specialises in gun dogs and the other prefers guard dogs. No flashy trends or social media hype here, just tried and true knowledge that stands the test of time. They bring you valuable insights and honest conversations about the social predator you share your home with. So here we go. About 45 minutes of gun dogs, guard dogs, good dogs, some maybe not so good dogs, and a dash of gossip.
Mr. McCarthy, how are you doing?
I'm good, thank you. How are you doing?
I'm good. I've warmed up. It is absolutely bloody freezing in Scotland at the minute.
Yeah, not much better in London. It's about 5 degrees, but I'm quite excited because we've got a special guest.
I know you don't have to listen to me for the next 45 minutes.
Oh, goodness for that. That's why I'm excited. No, it's a really we've got Andrew Armitage, haven't we? Who you've been dealing with, I know with Emirates, about regenerative medicine.
Yeah, really, really looking forward to talking to him. He explains things so easily, I think. So yeah, really excited. It's something that's close to my heart, talking about stem cell therapy. So Andrew had his degree from Edinburgh University, and he's been pioneering all the advanced therapies.
What's he been doing?
What did I say?
Pioneering. Sorry,
Pioneering.
you carry on.
Are
Pioneering.
you taking the mickey out of my accent?
No, as if I'd do that. No, I'm sorry. Carry on with his pioneering research.
Yes, in musculoskeletal conditions in animals, which is amazing work that he's doing.
Fascinating topic. So shall we shut up and welcome Andrew Armitage?
Well, yeah, especially if you're taking the mickey out of my accent, matey, definitely. So welcome, Andy. I'm so pleased that you came to talk to us. It's great to have you here.
Thank you for inviting me. I'm very pleased to be here.
Awesome. And I'm sure everybody knows who's listening and they've been following Emirates. So Andy is the vet that's been doing stem cell therapy on Emirates, and it's going really well. So I suppose we need to find out what stem cell therapy is first and then take it from there.
Yeah.
And then we can ask you all about you. Have you got a dog, actually?
I've got a variety of animals. I've got 3 dogs, 9 cats, alpacas, sheep,
Oh, wow.
canaries, bullfinches, peacocks, bearded dragon. I think that's about it.
Probably
Really?
enough.
Let's forget stem cell therapy and just ask you about your dogs and your alpacas. What are they like having them? They're amazing.
Oh, the alpacas are brilliant. And my wife does a lot of animal-assisted therapy with them. And she does a lot of work with their fleece and runs mental health workshops to process the fleece. And they've got a natural dye garden here where they grow various plants and things to create natural dyes to dye the fleece, and they spin all the fleece from the alpacas and the sheep and things. So yeah, we have a lot going on at home as well as what's going on at work, all
God, that's
involving the animals.
amazing. Do they spit? Because
They-
camels
they-
spit, don't they? And llamas spit.
Llamas spit. They can spit, but they don't tend to. They only do that if you're trying to cut their toenails or something like that.
Okay.
That they don't want done to them. But in general, no, they don't.
Wow. So why did you? I mean, you've just thrown me having all these animals now. I was expecting you to say, "Yeah, I've got a dog. I've got a dog and a cat." Wow. So what made you want to be a vet?
Well, I always wanted to be a vet from my earliest memories. I think from 4 years of age, I wanted to be a vet, and I didn't have any animals when I was growing up. When I was a child, I really wanted them. My parents wouldn't let me. I finally got a cat eventually, but no, and it's strange. my brothers are engineers and in IT, and my parents aren't medically minded. So I don't know really where it came from. I just loved animals and wanted to be a vet. And I became one.
Wow. And what about stem cells? What you put you down there? Did you do like orthopedics first or?
So I was a general practicing vet, and for a number of years, and I came to work at Greenside, where I still am, probably 2008, I think. And when I joined there, I was a GP vet, and we did farm work and equine work as well. So I was treating all animals, but during the day, I was mainly doing small animal work, and I'm always interested in new tech, and I've been using laser therapy for a number of years, using a class 4 laser, and I was seeing amazing results with that for pain management and wound healing, and I was really interested in the effects of laser therapy and how it did what it did. You know, shining a light onto a tissue, and you get a tissue response. And that was quite interesting. And I was one of the early adopters in the UK of using class 4 laser. And at the time, there was very little evidence for its use. Now there's a lot of evidence. And over the years, as data was published and evidence was published on the effects of laser, I started reading that, and I came across a paper where it was talking about laser therapy activating and stimulating stem cells. And that tweaked my interest, and I was like, oh, stem cells, what are these? And started investigating those. And at the same time as I discovered that paper, I met a lady who was a drug rep, actually, that was selling chemotherapy drug. And I started talking to her when she was in a practice visit, and she said, we started talking about laser therapy, and I was like, I'm really interested in stem cells and the effect of stem cells, and there's some work being done with stem cells for a variety of disease processes. She said, funny you should say that, because I'm setting up a stem cell lab with a colleague of mine who's a cell biologist, and it's going to be the UK's first veterinary stem cell lab. And I was like, wow, tell me more. So we started talking, and they were in the very early stages of setting up the lab, and we kept in contact, and they asked me whether I would help them look into the best ways of shipping stem cells and harvesting tissues to get stem cells. So I started sending them pieces of fat that were left over from surgery, so from bitch spays and things like that. Bits of fat that would have ended up in the bin normally, and with the owner's consent, we sent those to the lab, and we tested sending them at room temperature or and in cold packs and things like that to work out the best way to preserve the cells within the fat tissue, to courier them to the lab, and then they could do their extraction of the stem cells in the culture. So once we'd sort of worked out that process and the optimal way of doing that, they said as a thank you, they would give me 5 free cases to use stem cells in. They would supply all the stem cells free of charge. So I was like, brilliant. So I picked 5 of the worst arthritic dogs I had in the practice, and said to them, hey, look, we've got this opportunity to try out stem cell therapy for your dog's osteoarthritis, and would you be interested? And all of them were extremely interested, and one of them was my own dog as well. I had a Rottweiler at the time with hip dysplasia and arthritis. So I treated these 5 dogs with stem cell therapy, and the results were just absolutely unbelievable. I couldn't quite believe the results in it, and the rest is history, really. And that, so I became very interested in musculoskeletal diseases and the application of stem cells. And initially, I was just doing it for our own clients, and then I was getting referrals in. People were finding out about it and asking me to treat their dogs. And that was, about 11 years ago. And then I've gone from a GP vet to a vet now that specializes in regenerative medicine. And that's what I do 100% of my time. And we opened the first referral regenerative medicine rehabilitation clinic in the UK. And we now get dogs from all over the UK and Europe as well. I've had dogs from Cyprus and France come and visit us and get treated with regenerative medicine. So it was just a slowly evolving process, and we've grown the business quite organically. It's mainly word of mouth, and people find out about us, and we get a lot of referrals from physiotherapists and hydrotherapists because they treat the animals that we've treated and rehab them and see the responses, and they can't quite believe it, so they start talking to their other clients, and then they want to come as well. So yeah, it's been a crazy time, and I've gone from a GP vet to very specialist in what I do, and I find it very rewarding, and it's great to see these miraculous responses that we can get and actually use a therapy that's disease modifying. We're not just masking things with painkillers. We're actually changing the disease process, stopping it, reversing it, and healing tissues.
Can I ask you a couple of sort of foundation questions just about
of course.
Like, what are stem cells? How are they cultivated? And when you sort of mention about the application of them, what is that application? What does that look like?
So stem cells are the body's repair kit. So they are found within our bodies in various tissues. The highest concentration of stem cells in the body is actually found in fat. They are around all the micro blood vessels within the fat, and they sit there and wait for either damage or where they need to activate and repair a tissue. So they are actively involved in the body's repair process. So when you cut yourself and you bleed, the platelets within your blood form a blood clot. So they stimulate the clotting process, and they also form this fibrin clot that traps the red blood cells and stops the bleeding, but they also contain these little bubbles that contain all these growth factors and signaling molecules. And the platelets release those into the surrounding tissue, and that stimulates the stem cells that are in the fat to actually wake up and migrate from where they are in the fat to the wound, and then the stem cells project manage the healing process. So stem cells are an undifferentiated cell. So they have this amazing ability to turn into different cell types. So they can turn into bone or cartilage or fat or muscle, tendon, skin. The adult stem cells that are contained within all of us have a limited potential. So they can form new cells and new tissues, but they can't form new organs. So we can't grow a liver yet, or a new limb or something like that, but we can certainly repair muscle, cartilage, tendon, bone, things like that. And so these stem cells, not only do they turn into new tissues for repair, but they also project manage the healing response. So they talk to the other tissues and they send out signals in chemical form to modulate the inflammatory response, grow new blood vessels into the area, take away fibrosis and scar tissue, and repair and lay down new tissue as well. So in things like osteoarthritis, when we harvest the stem cells and culture them and inject them back into an arthritic joint, they project manage the healing process, and they turn off the inflammation and the pain, and they also stimulate a healing response and can turn into new tissues to repair joint capsules or cartilage or bone lesions and things like that, remodel osteoarthritis. So by doing regenerative medicine is a really targeted approach. So what we do is we identify all areas of musculoskeletal pathology, and then we need to target those stem cells into those areas. So the first thing that we do is extensive diagnostics. So we've got things like stance analysis and force plate analysis, where we can look at the motion of the dog and pick up where we are offloading, or where there's lameness or gait abnormalities or restriction of the joint range of motion. And then we focus our diagnostics into those areas. So take x-rays, do a lot of musculoskeletal ultrasound. We're one of very few centres in the UK that does musculoskeletal ultrasound in dogs. And this is really important for identifying soft tissue injuries. So even if you have arthritis, you will get compensatory issues in the supporting muscles and tendons. You can get tendinopathies and other problems. So it's really important to have a complete diagnostic approach and identify all areas so that we can treat it, because stem cells, it's a targeted treatment. So it's not like a drug that you take and it goes throughout the blood system and treats pain wherever it is. Stem cells, if there's a problem in the joint, we need to inject it in the joint. If it's a tendon, we have to focus it into the damage in the tendon. So yeah, the diagnostics are very important, and yeah, where we put those stem cells, they will have effects in all tissues. So whether that's in a joint or a tendon or a muscle or in the spine, they will stimulate the healing process. So normally we see the dogs, we do all our diagnostics, measure joint range of motion and physical exams and all our objective measures to identify where the problems are. And then we know what we need to treat, and then we harvest fat at that stage. So under the same procedure, we make, under a general anaesthetic, we make a small incision just above the belly button, and just into the abdomen there's a fat pad there called the falciform fat that sits just into the abdomen, and there's always fat there. Even in the skinniest of whippets we can get a nice fat sample, and we actually don't need very much. We only need about 5 grams of fat, a teaspoon of fat to send to the lab. We take more if we can, and this falciform fat pad contains the highest concentration of stem cells than anywhere in the body, more than bone marrow and things like that. So we take this sample of fat, put it in some sterile saline, and we ship that overnight courier to the lab down in Coventry, where they basically mince up the fat and put that fat into culture flasks. So these are plastic flasks with culture medium that stimulates cell growth. And stem cells have this amazing ability that they will adhere to plastic. So they will attach to the plastic culture flasks. And that's one of the unique properties of stem cells. And that enables you to wash off all the debris, so all the bits of fat and everything else, and you're just left with stem cells in this culture flask. And then the other amazing ability of stem cells is that they can replicate themselves. So if you put them in the right conditions, at body temperature, in culture medium, and incubate them, they will just divide and replicate themselves. So you can go from a few million cells to many million cells over a period of 10, 14 days. In culture, they will just keep dividing and replicating themselves. and they stay as these undifferentiated stem cells. And then the lab harvests those cells, so they wash all the culture medium off, and they resuspend them in the dog's own serum. So when we send the fat to the lab, we also send blood to the lab from the dog, and the lab removes all the red blood cells and white blood cells, and just gets the serum, which is the sort of fluid component of blood. And then they will resuspend all these stem cells that they've cultured into little vials in the dog's own serum, and then those vials are sterile and are sealed and are cryogenically frozen. So they're put in liquid nitrogen and frozen. And they do, sterility testing and viability testing on these cells to make sure that they're all looking okay and they're sterile, not with any bacterial contamination or anything. And then they ship them back to us in dry ice. So dry ice is about -80, so it keeps these cells frozen while they're transported back. And then at the practice, we have a very big and very expensive to run freezer that keeps those cells at -80. So it's -80 in those degrees Celsius in that freezer. And we place the vials in there, and we can store them in there for long periods of time. And then we get the patient back in and take out those cells, defrost them, and implant them into the areas of musculoskeletal pathology, so that they can have their effects. We always keep some of the cells back at the lab cryogenically frozen, and that gives us a lifetime supply of cells. So if we need to do further treatments in the future, we can go back to the lab, send them some more blood, and they can culture us up some more cells. And I basically send them a recipe. So I say I want X number of cells, 10 million cells in half a mil of serum, or various concentration of cells depending on what condition I'm treating, the size of the area I'm treating. So we don't want to put big volumes of liquid into a small dog's joint, whereas a big St. Bernard, we can put larger volumes in. So we can control that very precisely so that we don't put too much fluid into the joint when we go to treat them.
Wow, and it's just really mind-blowing because the cells take on whatever they need to be for wherever you put them, don't they? So
it's mind-blowing, isn't it? It's really mind-blowing.
It's
quite amazing. Plus that whole process.
What were can I ask the question about the lasers? I know we've gone back a bit, but what's the difference between a grade 4 laser and an ordinary laser? Because I don't know if you know that I used to be a kinesiologist years ago.
Right.
We used to use lasers for breaking down the calcification in a tendon way before lasers became used regularly, but they were just ordinary lasers, which really helped. So then to go through a grade 4 tendon laser, and also when Emrys had his laser treatment, he had to wear goggles because it was so powerful. But he's also been to an acupuncture vet, and she's done laser treatment at the end, and there's been no goggles. So what's the difference between the lasers? They're just the strength. So sometimes you have to have goggles on with a grade 4, but other lasers they don't need to.
So there's different types of lasers and different classes of lasers, and basically the class 4 laser is a more powerful laser. So and that's why they have to wear goggles, and the operator has to wear special glasses, because if you accidentally took the laser off the animal and it reflected in a piece of metal or something, and reflected it, that laser would be concentrated by the lens in your eye, and it could damage your retina. So they are quite powerful, and that's why the animals and the operator needs to wear those. There's a lot of recent evidence looking into laser therapy, because all light has an effect, a physiological effect on tissues, and the lower power lasers like class 3B do have an effect on tissues, but it's all about dose. So laser therapy is producing photons of laser light basically, and the class 4 lasers produce more photons, and you can basically for a tissue we know what sort of dose of laser that we need, and also we need to get those photons of laser where they need to go. So the problem with lasering tissues is that any cell or pigment will absorb those photons of laser. So if you've got hair, dark hair, a black lab, a lot of that photons are going to be absorbed before they even go through the skin, and fluid as well will absorb those photons. So we've got to get those photons deep into the joints and the muscles and tendons, and to do that we need increased power of those photons so that they can go deeper. And we know the dose that we need to give in joules per centimeter squared to get into the joint or the spine or deep tissues, and it's a class 4 laser can provide that dose in 3 or 4 minutes, whereas a class 3B laser, because it's lower power and there's less photons that have less penetrance, we would have to put that laser over that area for 3, 4, 6 hours to get the same amount of photons getting into those deeper tissues. So it's all about dose and the power of those photons. And wavelength's important as well. We could spend a whole podcast on the physics of laser, but it's all about the dose and the power.
And that stimulates the stem cells, doesn't it?
So when the photons go through the tissues, they're absorbed into the cells, and in the cells there's a little structure called a mitochondria, and that is basically the powerhouse of the cell. And basically when the photons are absorbed by the mitochondria produces more ATP. And ATP is the energy currency in the cell. So every cell function requires ATP. So you've got to think of it as the power source for any function in that cell. Without ATP, the cell will die, and it cannot produce any biological or physiological functions. So the laser therapy stimulates mitochondria and stimulates energy production in the cell. It also has effects on nerves and nerve endings, so it modulates the pain response. So it will affect the flow of calcium in nerves, basically. So I'm trying not to be too technical. Please tell me if I am.
I know, and I teach anatomy and physiology, so I'm nodding, and Ross is probably thinking, I've got no idea what you're talking about. But I'm like, oh yeah, I've got that. So
I think
when you do laser treatment on the stem cells, it's just giving it like a massive, like a kick of Red Bull almost, getting it moving, getting it.
Yes.
And it like super energizing the cell for healing.
Yes, yeah. So basically, it will stimulate their production, their physiological mechanisms. It also stimulates their proliferation, so it will encourage them to replicate. It has effects on the wider tissue as well, because it has effects on blood vessel, and it causes the blood vessels to dilate, so you get improved circulation into the area. So you get better blood flow, better oxygenation, nutrition coming into the tissues. So it's a real combination of things. So I always use laser therapy in combination with stem cell therapy. And I think for a long time, and this was the Americans' fault, said do not use laser in combination with stem cells. And I could never really understand why. And they said, well, potentially it could have thermal effects, heating up the tissues and killing the stem cells, or stimulating more blood supply and washing the stem cells out of the area. But I've always used laser therapy. As soon as I inject the stem cells, we laser them and then follow up with a few sessions of laser afterwards. And I found it works synergistically, and it stimulates the response. If you were using laser and you were going to heat up the tissues that you were killing cells, then you're doing something far wrong with the laser. The animal would be in discomfort as you was applying that laser if you were doing that. So that is, you have the potential with class 4 laser to overheat the tissues, but a lot of the lasers have contact balls. That certainly the one that we do has got a glass ball that the laser goes through, that you roll over the tissues, and that has two effects. One, to dissipate the heat, but also you're compressing the tissue, so you're forcing out some of that fluid that's going to absorb the photons of laser, and it compresses the tissues to allow those photons to penetrate deeper. But you've got to keep the laser in constant motion. If you just went over one area for 3 minutes, you would burn the skin, with a class 4.
I just find it really fascinating because I did a lot of light therapy as a kinesiologist, and like with light pens and or a Soman collide. It's really, for me, it's just like really fascinating. I'm sorry, Rob, it's probably really, you're sitting there going, huh?
I mean, it's amazing that light can have such an effect on tissues, and how they first discovered the beneficial effects was they were lasering mice to see if there was any side effects from different wavelengths and different types of laser, and they found that there was no side effects, but the areas of the mice that they were lasering, the hair was growing twice as quick as the other areas. And they were like, oh, what's going on here? So it was stimulating the hair follicles and increasing the hair growth.
That's what I did that.
Yeah, I should try it on me.
Just book an appointment for that.
What about different colours? So, because like everything's got the colours have got their own wavelengths and different vibrations. Would you use different colours, or would you not apply different colours through? Was it
with like different colours of laser light?
Yeah,
it's really going into the wavelength, and it's deep infrared basically that you're using there. So different lasers will have a different spectrum, but it is red light.
It's infrared. Okay.
So by default, I've got a couple of stupid questions, which are probably not the last of the stupid questions you'll get from me. Just the one that I thought of, you always use the animal's own stem cells for the treatment. You don't kind of cultivate stem cells and then use those on other patients or anything. It's always the animal's own.
So yes, so we do what's called autologous stem cell therapy. So it's stem cells taken from that patient, cultured, and then injected back into that patient. So there's absolutely no risk of rejection or reaction to those, because they're the dog's own cells with the dog's own genetic makeup, and they're resuspended in the dog's own serum from its blood. So there's nothing foreign going in. There is allergenic and xenogenic stem cells. So allergenic stem cells are where you take stem cells from one dog and put them into another dog. And currently that is not possible in this country due to regulation. Right. So we can't do that in this country at the moment. But stem cells are quite unique in that they don't have very many markers on the outside of the cells that the immune system recognizes. So it is possible to take stem cells from one patient and give it to another without a major immune response to it. So they're called immunoprivileged. And then we have xenogenic stem cells, which are stem cells from one species into another. So a dog going to a cat or a horse going to a dog. And there is actually a licensed product called Dog Stem that is xenogenic stem cells. So it's available in this country, and it's equine, so it's from horses' umbilical cords. And they've taken those stem cells from the umbilical cord and cultured those up, and they supply those as fresh cells that can be injected into dogs. I've tried them. I don't feel they're as effective as autologous cells. And if you look at the research there is an immune response to it. I think over 60% of dogs that are injected with the equine cells do develop an antibody response, an immune response to them. And there seems to be a bit of a injection site flare after injection of them quite commonly. But
why would you do that? Why would you use those instead of the animal's own stem cells? Just because of cost? Would that be?
Cost, and you don't have to have a surgical procedure to harvest the fat.
Right.
So that would, that would be the advantage, that you wouldn't have to perform surgery to get a tissue sample. But in my experience using them, the effects of them don't last very long. So with my protocols using autologous cells, we get normally a good 18 months to 2 years in between treatments. So for arthritis, we can turn off the inflammation and the pain and turn off the arthritic response normally for a couple of years. But with the xenogenic stem cells, they seem to have an anti-inflammatory response, but quite short-lived, sort of 3 to 6 months. And then my question, which the company can't answer, is if you need a repeat treatment, which you're going to if you've got arthritis, because you're not curing it, you're just managing it. If you give a repeat treatment and they've developed an immune response to it, is that second treatment going to be effective because the dog's immune system will recognize it as foreign, and there's the potential for more, sort of adverse reactions, joint flares and things like that.
So by the way that the stem cells work, it seems that it's a pretty much guaranteed that you're going to get a result for whatever period of time. It's not a case that it's not going to work, or are there cases whereby it doesn't have the desired effect?
So, we've been doing stem cells for over a decade, and we have a fantastic success rate, and you always get a response, and you always get a positive response. The magnitude of that response can be, it depends on what you're treating, but if you're using them in a targeted way, and the important thing is to treat all areas of musculoskeletal pathology. So I think when I first started doing stem cells, you would focus in on the bad areas. Oh, the dog's got really bad elbows. So you would treat them, and yes, they would get better and they would have a good response. But it's not until I started looking at the bigger picture and being like, well, actually that dog that's got elbow dysplasia and severe arthritis has got muscle loss and changes in range of motion of the shoulders as well. And we've got a problem there, and it's a bit weak on its back end. It's got a sore back. So once I started thinking, well, actually, this is a very targeted treatment. I'm putting the stem cells in the elbows. They have an effect in the elbows. We're seeing an improvement there, but maybe the dog's not as good as you was hoping. But if we've got lumbosacral disease or spinal arthritis or shoulder tendon issues as well, and we're not putting the stem cells into those areas, then they're not going to travel from the elbow to the shoulder and the spine and have their effect, because we put them in the elbow joint. So when I started, getting into diagnostic, and especially with musculoskeletal ultrasound, and we can look at all the soft tissues and not just what's going on in the joints, and identifying those areas and then applying those treatments into all the affected areas, that's when we was getting these miraculous responses. And I would say that we're dealing with biological cells and things, so you can't guarantee, but I can almost guarantee that we can get a response. If we don't get a response that we expect, then we've missed something. And I think a lot of these dogs with elbow dysplasia, because of the reduction in range of motion and the arthritis, they start to walk with their elbows rotated out. It starts to affect the range of motion in the shoulders and the way that the shoulder tendons are used, and you get repetitive strain type injuries there. And if you don't identify that and treat that, then you're going to get a suboptimal response. But where we've identified everything, treated everything, we get fantastic response, because we can treat arthritis. It turns off the pain, inflammation, repairs some of the cartilage, remodels the joints. We get better range of motion. In tendons, it removes scar tissue and fibrosis, can repair partially torn tendons. We get normal fiber patterns with, normal tensile strength. So you don't get those re-injuries that you commonly get with healing of tendons that heal with scar tissue. We can use it into the spine and discs for arthritis of the spine. So it will have an effect on tissues, on damaged tissues or diseased tissues, but you just need to put it in that area so it can have the effect.
So it's looking at the dog holistically rather than an elbow or a shoulder or a hip.
Yeah, because it's the same with us. If you've got a sore knee, the next thing you've got is a sore back, because it just, you're unbalanced, and it puts pressures on other areas. In a dog, you've got 4 legs, so what can start off as a left fore lameness can quickly result in discomfort in the spine and problem with the right hind, because they tend to offload across their body. And when you get changes in range of motion in the joint, that affects the muscles and tendons that are involved in moving that joint. And if you're overloading one leg because you're offloading another, then that's going to overload those tissues, and we start to see degenerative change in those tissues as well. So if you just focus in on the primary problem, then yes, you'll get a response, but then you'll probably unmask a lameness on the other side, because you've made one side better but not done the other. So we have a very much a holistic approach and treat all musculoskeletal conditions together. And I think we're quite unique in that. There are other places that do regenerative medicine, but they tend to focus in on the big problem areas, and not look as the animal as a whole.
It makes complete sense, doesn't it? But I can understand why you might overlook that. Do you know what I mean? Like, you're looking at that problem area, treating that, and overlook kind of the other damage that's been done by the animal compensating or whatever else.
But I think that also can result in sort of negative press for stem cells, because there's orthopedic surgeons that use it and they say, oh well, it didn't really work, but have they treated all the areas that need treating? And elbows is the prime example. I always scan ultrasound the shoulders of a dog with elbow dysplasia and elbow arthritis, because I would say 90% of dogs, 90% plus of dogs with elbow problems chronic elbow problems will have concurrent shoulder tendinopathies. And if you inject the stem cells into a very arthritic elbow and the dog doesn't get better, then you're going to say, oh, well, stem cells don't work. But they have, worked in the elbow, but they haven't affected anything in the shoulder. I had a case a few weeks ago that came to me that had it was 8 years old, diagnosed with elbow dysplasia as a puppy. It had bilateral arthroscopy and fragmented coronoid process removal, and it had done okay after that, and then got severe arthritis and was struggling. It had extensive physiotherapy, hydrotherapy, and they had a physiotherapist, a hydrotherapist, a pain specialist, an orthopedic surgeon, all managing this dog. And it had some stem cells in its elbows, and it had done well for a few years. And yeah, in the last couple of years, it's been struggling. So they've been treating it for 7 years, basically, these elbows, and got a lot of professionals involved. And the dog was struggling, didn't respond to its last stem cells. And she came to me as sort of a last resort. And the dog walked into the consult room, and I just looked at it and I was like, what the hell is going on with its back end? It just was so stiff in its hind limb gait and drop back end. So, you examine it and it can't move its hips. And I x-rayed its hips, and it had end-stage hip arthritis in both hips. And this dog had been treated for 7 years, and nobody had ever looked at the hips. And they just keep focusing on the elbows. And it's no wonder that the dog's not getting better. And its elbows were actually quite comfortable. It was the rest of it, its shoulders and hips and lumbosacral disease that was causing the problem. And that's why it wasn't getting better. And then so we did a holistic approach, and the dog's awesome, doing so well now. But it's just, you have to look at things as look at the whole picture.
Yeah, because that happened before I brought Emrys. He went and we saw an orthopedic surgeon, and she looked at his elbows. She looked at his right elbow, she looked at his right shoulder, but his back end was a mess because of recruiting and the way he'd changed his position walking. And I'm just really glad we brought him to you. really, really just can't wait to get out with him again. Ross, you've got more questions, haven't you?
Yeah, I had another silly one of my own. Are stem cells frequently used to promote healing from kind of like operations, or like if you were to do like a hip replacement operation or something like that, would stem cells be used to support recovery, or that's not?
You certainly could do. With a hip replacement, you're taking the whole hip joint away and you're putting in a prosthetic joint. So it wouldn't be as helpful there, but certainly a lot of dogs with bad hips for a long time will have an iliopsoas tendinopathy, so you could use the stem cells there. One thing I do is for things like cruciate disease. So if you've got cruciate rupture, I would always recommend surgery, because if you've got the cruciate ligament that's in 2 bits, it's completely snapped, stem cells are never going to grow that back together. But what we know, of course, is as soon as you damage your cruciate, you get instability in the joint, you get cartilage damage, and then you get arthritis. So you can do your cruciate surgery, whether that's a TTA, TPLO, or a lateral suture. You can stabilize that joint and treat the cruciate disease, but that joint will go on to develop arthritis if it hasn't already. A lot of these cruciates are chronic degenerative, and they very commonly have arthritis at the time of surgery. So in that situation, yes, I would repair the cruciate, and then in an ideal world, put in stem cells there to manage the arthritis. Going forward, surgery can do so much, but it does nothing for the arthritis.
No. Fascinating. Les, ask about your elbow and hip scores you were going to ask about, weren't you?
Yeah, because what I found was just over a year before we brought Emrys, he had a 0-0 hip elbow score from the kennel club, the BV or whoever it is who does the scores. And since I put out the video about Emrys, I've had so many people contact me with their Labradors, and they've said my Labrador's got arthritis, he's lame, and he had 0-0 elbow scores. What do you think's going on with that, Angie? Because I know, like, we tend to think of arthritis as an old dog's disease, but it starts young, doesn't it? And it's only when they get older that it comes out. And I believe that the kennel club's dropping the elbow scores for Labradors. It's not compulsory anymore. So is that really common that Labradors, and I say Labrador because it's my breed and it's notorious. Is it really common that they're coming through with 0 elbow scores and then still developing arthritis?
The problem with the hip and elbow scores, it's the best we've got available at the moment. So you're the people that are doing the scores, they're looking at X-rays normally. When the dog's just over 12 months old. I mean, they have to be 12 months before. So it's and people are doing this because they want to breed from their dogs. So they tend to get the elbows, X-rayed at just over a year old, and they're scoring, for any arthritis and joint incongruity, any signs of elbow dysplasia, but it's not a perfect mechanism, and you can have elbow disease that doesn't show up on the X-ray. So CT scans are more helpful because it's a 3D image.
I was going to ask that because the surrounding of the bone, the cartilage, that would show first, wouldn't it? But that wouldn't be necessarily shown on an X-ray.
I mean, what I find the very first signs of arthritis is if it's associated with elbow developmental disease, is what's called subtrochlear sclerosis. So you will see that on the X-ray, but what you might not see is like a fragmented coronoid process. They can hide on an X-ray, whereas if you've got a 3D scan, that can pick them up. But even with CT, sometimes it doesn't show up, and you need to put a camera into the joint to visualize, what's going on within the joint. But I think, from an X-ray, they're scoring joint incongruity, but it's not perfect. So you could still have some mild incongruity where that joint doesn't quite fit together properly, but it's not evident on X-ray, and then you'll get cartilage damage over time with use because that joint doesn't fit quite properly.
Doesn't fit properly.
And then you'll get arthritis. But arthritis is not a disease of old age. Most of my patients are, 70% of my patients are Labradors, and a good 90% of those are elbows. Unfortunately, there seems to be a real epidemic of elbow dysplasia in dogs over the last few years. It's incredibly common. And
is that breed related? Do you think that you said about the Labradors, is that breed related, or is that the area that you work in, like location wise?
It's breed related. I mean, as I say, we get referrals from all over the UK. Okay. So although we're based in the Scottish borders, most of our clients are coming from England, and we get clients coming from the south coast of England, and from the islands and the Highlands and everywhere. So, I published some of my data on, and I had about 250 dogs that I published stem cell response. So it was basically, I just took all the dogs that I'd seen for about 5 years, and we looked at all their data, because we collect a lot of objective data, all their force plate stance and goniometry and everything else, and follow that over time. And it was interesting when I did that, and so you put in all the dogs' breeds and everything, and it was 70% are Labradors, and you know, a very, very high percentage of those elbows is the primary problem.
Wow.
So it is breed related. I mean, it's breed related, and they're a very popular breed. So there's lots of them as well. So, you know, that influences things as well. But I see a lot of Labradors, and I see a lot of Collies, and I see a lot of Collies because they're normally agility dogs or working dogs, and therefore you get a lot of problems, musculoskeletal problems, as you do with any athlete. So that's why I see a lot of Collies, but Labradors makes up a lot of my work for sure.
Do you see, have you kept stats on like the different dog sports? Because I mean, Ross had a Rotty with arthritis, didn't you? It's had arthritis in his front, and you know, just the different dog sports, because there's lots of different.
Well, he was the working trials dog and used to go over a 6-foot scale, so obviously that was a contributory factor in the development of that. But yeah, dog sports. I mean, you would see, I mean, like fly ball and things like that. You'd get a lot of.
I mean, fly ball. You get a lot of carpal damage, wrist damage, and a lot of shoulder problems. I mean, when you see it makes me cringe watching them.
I've got a video where I put a thing together on dog sports, and it just shows the impact on the joints, and when they hit that board and the wrists. Horrible.
And agility dogs, when they're doing the weaves and things, you know, that puts a lot of lateral motion on the shoulders, and we see a lot of medial shoulder instability or medial shoulder syndrome in agility dogs. So different sports results in different problems. You know, if you're doing a lot of A-frames and things like that, German Shepherds, we see a lot of lumbosacral disease and hip problems, and iliopsoas issues, but then they're predisposed to that anyway.
So definitely don't do agility with your Labrador. We can conclude that.
Yes.
But it's like with any athlete, you know, if you're doing a lot of physical activity, you know, you get wear and tear.
RSI,
you know, and it's all about having your dog in peak health and peak fitness and proper training, proper warm up, cool downs, and everything else. You know.
Yeah. Brilliant. Have you got any more questions there? Karen asked one about the immune system, didn't she? So one of the questions that came in was in relation to, because you're working with the dog's own with its own cells, if you're over vaccinating or overusing chemicals on the dogs, would that have an impact on how efficient and how effective the stem cell treatment would be?
I mean, I think, I haven't found any relation to the vaccinal status of the dog and the effect of stem cells and the response that we get. I see equally good responses in vaccinated dogs as well as unvaccinated ones. So I think, you know, with vaccines, it sort of stimulates a different part of the immune system to what we're doing with the stem cells. But there's certainly drugs that will affect stem cell therapy, and there's certain drugs that I definitely won't allow the dog to be on if they are having stem cells, and most of those are immunomodulatory drugs. So any chemotherapy drug obviously will have a very potent effect on inflammation and the immune system and cell replication. So any of the chemotherapy drugs definitely out. and then there's drugs like Apoquel, which is for allergic skin disease.
Oh yeah, that can be quite common, can't it? I know
Yes,
that have been on
and
that.
I found out the hard way with that, and it just seems to stop stem cells from doing anything. So I had a couple of
Wow.
dogs that I treated, and they didn't get better, and I was like, "What's going on here? I must have missed something," but hadn't. And they were on Apoquel, and
Scary.
it's anti-inflammatory for allergic skin disease. So you can, when you look into this pharmacological mechanism, you could see perhaps why. So we stopped that dog's Apoquel, had a washout, and then treated them again, and then they improved. So Apoquel is a definite no-no. Other drugs for like allergic skin disease or autoimmune disease, things like cyclosporin or atopica, and steroids, prednisolone, corticosteroids, I would avoid unless absolutely necessary, because they have very potent anti-inflammatory effects. And part of the healing process that stem cells modulate is modulating that inflammatory process and using that in the healing process. So we don't really want to suppress that. And then like conditions like hypothyroidism, low thyroid. Thyroid hormone is very important in all tissues and homeostasis in tissues and tissue function. So dogs that are hypothyroid, if they're not being treated for that, will have a suboptimal response. So that's something that we commonly check is thyroid levels before we start treatment.
But if they're being treated with like T3 and T4 or just T4, then you would then work
So
with.
we would take a blood sample and look for total T4 levels, and if they were suboptimal, we would supplement that with thyroid hormone before we started treatment.
I've got a question. One of the people have sent in a question about Librela. Can I ask you about that?
Have you been waiting for that one, Andy?
I don't know what that. I don't know what
have been waiting for that one. And have you got several hours?
Well, her question. I'll tell you what her question is, and then you can like answer it or ignore it, whatever. Apparently, the FDA report published December 24 in the States was about the rising adverse effects of Librela. Are there the same concerns in the UK?
Yes.
Yeah.
So Librela is a novel type of painkiller in that it's an antibody against NGF, nerve growth factor. So it's a bit different to most drugs. And basically what it does is it knocks out NGF, which is overproduced in joints that have pain and arthritis. So it basically, knocks out this NGF receptor, and that's how it exerts its pain-killing effects. But there seems to be a lot of adverse events occurring with this drug, and I've certainly seen that. It is, when it works and there aren't side effects, it's a fantastic painkiller, and I've seen a lot of dogs whose lives have been transformed with it. So it does have a lot of positives, but I think once the drug was introduced into the States just over a year ago now, there was massive use of it, and there's been, because of the amount of the drug that was used in the States, the amount of adverse reactions that have been reported went up massively as well. So there's a lot of things that can be blamed on Librela that probably isn't Librela, but there is definitely adverse events that do happen, and with any drug, that is possible. No drug is completely benign and has no side effects, and yeah, what I was seeing was dogs drinking more, urinating more, sometimes becoming incontinent. But more worryingly, I saw dogs that were having, yeah, sort of central nervous depression and sort of dementia type changes, behavioral changes, depression. Some dogs completely going off food, like just not eating food, aversion to metal food bowls, um, things, and weakness at the back end, ataxia. So they would start walking like they got a spinal problem, and some dogs being reported to be paralyzed, increased seizures, and the list goes on. So the FDA has collected all these reports of adverse events, and they've updated the data sheet in the States, and that will happen over here as well, where they will report these potential side effects. But it's still, the drug is still relatively new. So with any drug, once it gets marketing authority, it's released and it starts to be used, and then the VMD in this country or the FDA in the States collect information on adverse events and compile that and monitor it. And I guess that's sort of the next stage in the trial of the drug is using it in the general populace and seeing what happens. I think, a lot of people have said X has happened to my dog and it was Librela that did it, but there will be a lot of old dogs with concurrent disease processes and problems that could be blamed on Librela, and it isn't. But it's very difficult to weed that out and which ones are actually Librela reactions or not. So, it's when it works and it doesn't have side effects, it's a very, very helpful drug. But I think a lot of vets were sort of told that it didn't have any side effects and you should use it for arthritis, and a lot of vets started dogs on it without accurate and up-to-date diagnostics. So I would only use it for dogs with arthritis. I wouldn't use it for any dogs with neurological conditions or any other conditions, and only when its pain-killing activities is no better than something like Metacam. So to change from Metacam to Librela, I would have to have a reason to do that. The dog can tolerate Metacam, and I would want to rule out any neurological problems. But something that I've been seeing in the last 12 months, because Librela's been on the market for 3 years plus in the UK now, over the last year, and especially in elbows, I've been having dogs referred to me that have had, elbow dysplasia and arthritis that's deteriorated and doesn't seem to be controlled with drugs. And when I x-ray these dogs, I've started to see changes on the x-ray that are weird. So with arthritis in joints, it tends to be around the joint. We get all this cartilage loss, and then we get new bone formation, or these osteophytes. So we get all these spiky bits of bone growing around the joint margins. But I've started to see dogs now with these arthritic looking bones, but it almost it doesn't look like arthritis because it extends up the bone away from the joint, like quite
what
long
the
way.
osteophytes do.
Well, I'm trying to come up with a term for them. They don't. Then it's new bone production, but it's not an osteophyte, because an osteophyte is on the joint margins. These are going up the epicondyles and up the long part of the bone as well, extending some distance away from the joint, and also getting a lot of mineralization in the flexor the flexor tendon enthesis on the medial epicondyles of elbows. So this was something I would occasionally see, this flexor enthesiopathy, it's called, mineralizing enthesiopathy. But in the last year, I've seen dog after dog coming in with this, and all this weird arthritic bone. The first case, you're like, well, it's just end-stage arthritis and it's just really proliferative bone. But then I've been seeing more and more, and the common factor is that all these dogs have been on Librela, and they've been on it for a year or more. And so I started compiling these and pulling them out, and my other colleagues have seen these cases. So we've got about 40 dogs that you look at the x-rays and you're like, that's weird. And I've submitted these to the VMD as an adverse reaction, and I've been speaking to other vets in the UK, and there's certain other centres that have been picking this up as well. And
Wow.
And so I think it's something that we're going to see more of, because it takes time to develop. But if you look at the mechanism of Librela and this anti-NGF, there was a similar anti-NGF antibody developed as a drug for humans, but it never got past the clinical trials because in some patients it caused a condition called rapidly progressive osteoarthritis. So it wasn't licensed in people, and the studies in the rats showed something similar as well. So what in humans, what was happening, you get a lot of subchondral bone, like the bone underneath the joints, like collapsing, and it's slightly different to what I'm seeing, but has similar consequences for the joint, where we get this rapidly progressing arthritis, and these dogs are really difficult to treat. Even with regenerative medicine, they don't respond like they should. So it's a bit worrying. It's something that I'm investigating, reporting, and collecting more data on. But I do have concerns that Librela might be the underlying cause, or potentially Librela along with another drug, or potentially is there something? And the weird thing is I mostly see this in elbows. I have seen it in digits as well, in the toes. But what I can't understand is if you're giving it as an injection, it goes throughout the body. Why doesn't it affect all the joints? Why is it only certain joints? And I think what it is if you've got instability in a joint and arthritis and they're on long-term Librela, that's when you get it. So I've seen it in dogs with HOC OCD, and the joints a bit loose, and you get these proliferative arthritic type lesions in the HOC as well. But I would say black Labradors are overrepresented. And is there some genetic component to that?
Gene.
So and there's other receptors in the joint that's similar to NGF, and in those dogs, is the Librela affecting other receptors and turning off some other housekeeping effect in that joint? We don't know, but it's been observed, and not just by me, but I seem to be seeing more than anybody else, but that's probably because I'm recognizing it. And we've had a few dogs that we've got x-rays before they went on Librela, and then x-rays a year later, and the difference is like arthritis doesn't progress that quickly. Like in that year, it shouldn't look like that, even with no treatment. So yeah, it's weird, and the problem is a lot of vets are not taking those x-rays before they put them on Librela. So they're like, oh, this joint is stiff and sore, it's arthritis, let's put it on Librela. And then a year later, the dog's really struggling, then they x-ray, and they're like, oh, look, it's end-stage arthritis. I told you so, and that's why. But if you'd x-rayed a year before, would it have looked like that?
No yardstick.
Not.
There's no yardsticks, is there?
No. So I think, yeah, Librela is a useful drug, but be careful until we get more information and make sure we have an accurate diagnosis and monitor these dogs and make sure that there's no other concurrent issues. And I'm collecting data, and I will publish something once I've worked out what's going on.
Thank you for sharing that with us. That was
it's amazing. No wonder you pulled the phone and mentioned it.
I know the reaction. So I know we've run on a bit because it's been so interesting talking to you, but Angie, can I just ask you one last question? Are you, and I'm saying you rather than the veterinary profession, are you kind of ahead of what's happening with humans? Because I mean, it's something that I've got connective tissue disease, and so I'm hypermobile. I've got loads of issues with my tendon and my joints, arthritis, and I'm listening, thinking, oh my God, you know, should I be booking myself in with you?
Well, I think every dog that's referred to me, the owners always ask if I can do it on them. Everybody's got aches and pains and problems, but it's not that the veterinary field is more advanced than humans. It's just there's more regulation for humans. So before a treatment can be used in people, there has to be so much research and make sure that it's safe and everything else. So there's just more red tape to go through. But there are, it's been done in humans for sure. All the human athletes are getting it done. Tiger Woods has had it done. A lot of the pro golfers for their shoulders, lumbar spine, hips. A lot of the Australian Football League, they all get it done. There's a place in Australia that's doing it. You can go to Mexico, get it done. There's a place in Germany. I think there's a place in Manchester actually. And
I need to look into it because I had a bone in my thumb removed, because of arthritis. So I'm going to get my research done.
Sure.
Or I'm going to come down and say, can you experiment?
It's not available on the NHS yet.
No.
Andy, just before we go, could you give your website details out just so that people can find you if they want more information or where they should be going to have a little look?
Yeah, so we've got a website that's www.stemcellsscotland.co.uk, and we've got a whole wealth of information on there all about the treatments that we provide and diagnostic approach and all of the background on stem cells. We're also on Facebook. We have Greenside Regenerative Medicine and Rehabilitation page on Facebook, but the website's got all the information on, and it's got an education tab where we've got lots of the paper that I published as well is there, and we've got a lot of webinars recorded on there that you can watch if you want to learn more.
Brilliant.
Awesome. That brilliant. Angie, thank you so much. We've learned so much. It's been absolutely fascinating talking to you.
No problem. Well,
been amazing. Thank you very, very much for your time.
No problem at all. Thank you.
Thanks for listening. It's not just gun dogs and not just guard dogs, but all things canine, as we hope you have discovered. Please like, share and subscribe and help us spread a bit of common sense back into dog ownership. And a review wouldn't go amiss either. Catch up with Les and Ross again in about 14 days for more canine conversations. Until next time, stay well and enjoy your dogs. Any dog-related questions or topics, just drop an email to talk@cfba.uk or message us via facebook.com/gundogs and guard dogs podcast.